When I started reporting on how Medicaid cuts would affect rural health care, I didn't expect to hear about young men like Alex Jacobsen. For Alex, Medicaid was a lifeline. His father, David, says it supported the rural Iowa hospital where Alex received mental health care. Usually, the conversation about gaps in rural areas focuses on young women. That's because so many rural hospitals have stopped helping young mothers. Between 2011 and 2023, 24% of the country's rural hospitals stopped providing obstetric services. But when I talked to midwife Peggy Gautreaux in Louisiana about those numbers, she raised another issue: the growing number of men showing up at her clinic for mental health treatment. When care is embedded in a local clinic, when patients don't have to drive hours or wait in a psychiatric emergency room, they're more likely to use it. That's especially true for men, Gautreaux said, who often face more stigma when seeking help. If you're sitting in our waiting room, nobody knows if you're here for a sore throat or because you couldn't get out of bed this morning, she said. So what happens when Medicaid cuts make those services harder to find? That's what worries Alex's father, David Jacobsen. He's seen the system fail. One night, his son called him desperate for help. They waited for hours in the emergency room until a bed opened in Sioux City, more than an hour away. Protocol meant police had to take Alex there in handcuffs. At a recent town hall, Jacobsen's Senator Joni Ernst of Iowa was asked about Medicaid trade-offs. A constituent warned that people will die if they lose coverage.
Well, we all are going to die.
Yes, we all die, says Jacobsen, whose son Alex died by suicide 5 years ago. But it's not about dying, he says. It's about compassion. It's about helping the vulnerable while they're here.